today. Mr. Speaker, honorable members, let me now turn to healthcare, the foundation of human dignity and the heartbeat of every nation that chooses compassion over neglect. Over the last 3 years, we have undertaken the most ambitious transformation of health systems since independence. Reforms rooted in equity, powered by innovation, and guided by a simple conviction that every Kenyan, wherever they live and whatever their means, deserves equal care. 27 million Kenyans are now registered in SHA, more than triple the number ever reached by the former NHIF. This is a demonstration that leaving no one behind was and is not a slogan. It is a promise on course to fulfillment. Additionally, more than 10,000 health facilities across the country have signed in to serve under this new system. But honorable members, real healthcare begins long before patients reach a hospital. That is why in September 2023, we deployed 107,000 community health promoters, the largest primary health workforce in our history, trained, equipped, and present in every ward in all our 47 counties. Their impact has been extraordinary. Consider 3 statistics. 8.9 million households have so far been visited. 9.9 million diabetes screenings have been done with 134,000 cases diagnosed. 6.5 million hypertension screenings have been conducted with 300